For neurologic trauma, which is the traumatic brain injury, we will going to define first what is brain injury. So, a brain injury, it is the injury to the skull or brain that is severe enough to interfere with normal functioning. So, for the types of brain injury, we have the diffuse axonal injury and also the focal brain injury. Okay, first let's have the focal brain injury. This type of injury, it includes the contusions and any several types of hematomas. Then for the diffuse axonal injury, it results from the widespread shearing and rotational forces. So due to shearing and rotational forces, it will going to produce brain damage throughout the brain, specifically to the axons in the cerebral hemispheres, corpus callosum and brainstem. So it is also associated with prolonged traumatic coma, and it is more serious with a poor prognosis compared to the focal lesion or focal brain injury. Then for the damage of the brain, it may take into two forms, which is the primary injury and secondary injury. For the primary injury, it is the consequence of direct contact to the head or brain during the instant of initial injury. And for the secondary injury, it also evolves over ensuing hours and days after the initial injury and results from inadequate delivery of nutrients and oxygen to the cells. For the pathophysiology of traumatic brain injury, so based on the Monroe-Kelly doctrine, which I get my source, so the cranial vault contains of three main components. So the cranial vault, the three components are the brain, blood, and cerebrospinal fluid. So since the cranial vault is a closed system, and if one of the component will going to increase in volume, supposed to be at least one of the other two components should or must decrease in volume or the pressure will going to increase. So example, if the patient is suffering from traumatic brain injury, so there will be a bleeding or swelling within the skull, and it will going to increase the volume contents within the skull. So therefore, it will causes increase in the ICP, which is at the intracranial pressure, wherein the brain tissue expands and the inflexible cranium and the intracranial pressure will going to exert by the volume of the intracranial contents within the cranial vault. So it will going to rise and the cerebral perfusion is impaired. If the pressure increases enough, it can cause displacement of the brain throughout and against the rigid structures of the skull, so which it causes restriction of the blood flow to the brain, and it will going to decrease the oxygen delivery and decrease in the waste removal. So then the cells within the brain become anoxic and cannot metabolize properly. It will going to produce, or the ischemia will going to occur, and also the infarction. So then the intracranial pressure continues to rise and their brain may herniate. Since it is irreversible brain damage, the cerebral blood flow will going to ceases or eventually can lead into brain death. So for the clinical manifestations, actually it depends upon the severity and the location of the injury. So, for example, we have the scalp wounds or the scalp injury. It tends to bleed heavily and are also portals for infection. So, although the skull injury is classified as a minor injury, it is still a life-threatening, because if there is a large avulsion or a tearing away of the scalp. And then we also have the scalp fractures. For the scalp fractures, it is usually have the localized persistent pain for the fractures of the base of the skull. So it is a break in the continuity of the skull caused by forceful trauma. It is classified by type or by the location. And any fracture of the base of the skull is called as the basal skull fracture. It tends to transverse the paranasal sinus of the frontal bone. Therefore, frequently it will going to produce hemorrhage from the nose, pharynx, ears, and blood that appears under the conjunctiva. And then it also have the CSF leak, which is a hollow sign ring of fluid around the blood stain or from the drainage. Another clinical manifestation, it is the altered LOC or level of consciousness, pupillary abnormalities, or sudden onset of neurologic deficits and neurologic changes in sense, movement, and reflexes. Then changes in vital signs, headache, and seizures. So now let's proceed to the brain injury, which is a close or blunt. So, and when the head accelerates and then rapidly decelerates, or it will going to collide with another object, like for example, in the wall, or a person is bumped into a wood door, so the brain tissue is damaged, but there is no opening through the skull and dura, so that is called as the brain injury, close or blunt. And if the object penetrates the skull and enters the brain, damages the soft brain tissue, and in its path, or when the blunt trauma to the head is so severe already, which it opens the scalp or the dura to expose the brain, it is also called as the brain injury, open or penetrating. For the diffuse axonal injury, it is the widespread axon damage in the brain that can be seen within the head trauma. So the patient develops immediate coma, and it can also have the intracranial bleeding, which are the epidural hematoma, subdural hematoma, acute and subacute, and chronic. And then we also have the intracerebral hemorrhage and hematoma. So concussion is an example of a diffuse axonal injury, because the patient may be admitted to the hospital for observation, or it can be sent home. So it can also have the observation of the patients after head trauma, and then it will be going to report immediately if there is a changes in level of consciousness as being observed. And then also have difficulty in awakening, lethargy, dizziness, confusion, and irritability, or the anxiety. Then it is also important to report immediately if the patient is having difficulty in speaking or movement, severe headache, vomiting, and then the patient should be aroused and assessed frequently. So in this picture, we have the locations of subdural and the intracerebral and the epidural hemorrhage. Then in this picture, we can see the epidural hemorrhage. So for the epidural hemorrhage or epidural hematoma, so there can be a blood collection in the space between the skull and the dura. So the patient may have a brief loss of consciousness with a return of lucid state. Then as hematoma expands, it will going to increase the ICP, or the intracranial pressure, that will often suddenly reduce the level of consciousness. Then the patient will going to have an emergency situation. So for the treatment, it includes the measures to reduce the intracranial pressure, and then remove the clot, and to stop the bleeding, burr holes, or the craniotomy. Then the patient will need to be monitored and support of vital body functions, especially to the respiratory support. Next, we have the subdural hematoma. So it is very important to have a collection of blood between the dura and the brain. So there will be also acute, and subacute. So for the acute, it can have a symptoms that develops within 28 to 48 hours. And then for the subacute, it can also have a symptoms that develop over 48 hours to 2 weeks. Then if the patient have an acute or subacute, it requires immediate craniotomy and control of ICP, or intracranial pressure. Then if it is chronic, then it develops over weeks or months. Then it is causative injury may be minor or forgotten. Then the clinical signs and symptoms may fluctuate. And then the treatment is evacuation of the clot. And for the intracerebral hemorrhage, So this hemorrhage occurs into the substance of the brain. It may be due to trauma or non-traumatic cause. For the treatment of the intracerebral hemorrhage, we have the supportive care, the control of ICP or intracranial pressure, then administration of fluids, electrolytes, and antihypertensive medications. For the craniotomy and cranectomy is to remove clot and to control hemorrhage. This may not be possible due to the location or lack of circumscribed area of the hemorrhage.
The diagnostic evaluation, which includes physical and neurologic exams, skull and spinal x-rays, CT scans, MRI, and PET. The nursing process, the care of the patient with brain injury assessment, health history with focus upon the immediate injury, time, cause, and the direction of the force of the blow. So, the time when did the injury occur, the cause, what caused the injury, like an object striking on the head or a fall, and the direction and force of the blow, which is the intensity of the blow. Then the baseline assessment, the Glasgow-Coma scale, or the level of consciousness. So if you assess the level of consciousness, you would use the Glasgow-Coma scale. Frequent and ongoing neurologic assessment, multi-system assessment. The nursing process, the care of the patient with brain injury or their diagnosis. There are different kinds. Ineffective airway clearance and impaired gas exchange, ineffective cerebral perfusion, deficient fluid volume, imbalanced nutrition, risk for injury, risk for imbalanced body temperature, risk for impaired skin integrity, disturbed thought patterns, disturbed sleep pattern, interrupted family processes, and the deficient knowledge. The nursing process, the care of the patient with brain injury or planning. The major goals may include maintenance of patent airway, adequate CPP or the fluid and electrolyte balance, adequate nutritional status, prevention of secondary injury, maintenance of normal temperature, maintenance of skin integrity, improvement of cognitive function, prevention of sleep deprivation, effective family coping, increased knowledge about rehabilitation processes, and absence of complications. So the nursing interventions, number one is maintaining airway. The second nursing intervention is monitoring neurologic function. Then number three is the vital signs. So this intervention is on vital signs is critical. It is because the patient may be at risk of external bleeding or internal bleeding from the patient's brain. Then 4 is monitoring fluid and electrolyte balance. So it means that the patient is in state of hypovolemia. Then promoting adequate nutrition, maintaining body temperature, maintaining skin integrity, supporting family coping, preventing sleep pattern disturbance, and monitoring and managing potential complications. So that will be all for neurologic trauma.